Good morning, everyone. As everyone joins us, thank you so much for joining us today. We are on series 8 of the Partnering to Crush the Curve series. Today's topic is on mental health and wellness during COVID. We know this is a major issue, especially in the African continent, one that has not gotten a lot of attention recently, and I think one that COVID has really surfaced as a very pressing issue that needs to be addressed. So as you all join, it would be great to just let us know in the chat where you're coming from. We see I already see some familiar names, some folks that have joined us before, so welcome to everyone who's come before. Welcome to those of you for maybe this is the first time joining us. So yeah, just let us know maybe your organization, the country you're logging in from. And we'll maybe give it a few more minutes for some more folks to join. Yeah, hi Safia, good to see you again. Thanks for joining. Okay, great. So I think we're a few minutes after the hour and we already have a good number of participants. So maybe Frank, I'll turn it over to you to welcome everyone.
Thank you, Ariel. Morning, everyone, from wherever you are. Greetings from very cold and freezing Johannesburg. It's 5 degrees. You wonder if it's discussion African temperature, but so be it. Welcome. This is, as Ariel has mentioned, this is the 8th in the series of these joint webinars we've been hosting around crushing the curve, looking at especially how Africa is responding to the COVID crisis, and more so on issues related to the most vulnerable in our communities. We are very proud of the momentum we've gathered through these webinars and the value we've added to a lot of people. And we hope that we can continue to add value to you as participants in this series. So thank you for taking the time to come on board today. I want to especially thank the speakers who made time to share with us what they have learned, what they have been practicing, their craft, and hopefully we can all live here with something of value to go and implement and hopefully solve the problems a lot more creatively and a lot better. I'll hand it over now back to Ariel, and wishing you all a very delightful webinar.
Great, thanks so much, Frank. And my name is Ariel. I'm with the SANCAP team. I'm based in Nairobi, Kenya. And we're hosting this series in collaboration with AVPA, just because it's really important to convene people right now and really talk about solutions to very real challenges that the African continent is facing. And we're really happy to be doing this with AVPA. Margaret, if you can go to the next slide, please. So just to give you guys a quick introduction of the speakers that we have lined up. We have Olaide from Dyslexia Nigeria. We have Nomfundo Mogapi from the Center for Study of Violence and Reconciliation. We have Mr. Bright Shitema from Mental 360, and we have Dr. Wanjiru Kaigwa, who's a Harvard Medical School Clinical Research Fellow. And we'll hear from all of those in just a few minutes. So Margaret, if you can go to the next slide. So we'll give each of the speakers about 7 to 8 minutes to speak. I think we have reserved about an hour and a half of their time today. And if you have any questions as we go, please put them in the chat box. We'll field questions to the speakers at the end of the presentations. And they might, be able to respond directly on the chat box as well. So feel free to engage that way. And we do ask that you, as participants, just stay on mute. And if you want to make a comment or say anything, you can raise your hand. There should be an option for you to sort of raise your hand in the participant window there. So yeah, so we want to definitely reserve a good amount of time for Q&A. So we're going to get started here just before our first speaker with a quick audience poll. So we just sort of want to know how you guys are feeling today. It's anonymous, so we don't know who's saying what, but given that we're doing this session on mental health, we really want to hear from the audience how you guys are coming in today and how genuinely you're sort of feeling with the COVID situation. I think it's a real drain on everyone, and I think it's surfaced a lot of challenges for a lot of people. So So go ahead and put your response in. We'll give it maybe another 10 or 15 seconds. And it looks right now like a lot of people are sort of middle of the road. Few people doing great, few people doing really poorly. So most people are about average. So I'll give it another 2 or 3 seconds to please put in your response. And I will show that out. All right. So most people, some days have good, some folks have good days, some folks have bad days. So we're, as a group, I say we're not doing too badly. That's that's not a bad thing. So thanks for that. I think it's really great to, to see that I think people are not alone and we're all sort of struggling, with this COVID situation. So Margaret, if you want to go to the next slide, I'll call up Nomfundo as our first speaker today. Nomfundo, over to you.
Thank you so much for having me from this very cold South African weather. So what I want to talk about today is really understanding why it's important for us to focus on mental health and mental wellness in Africa generally, but I'm coming specifically from an experience from South Africa. And then I hope to just touch base on an initiative that we're doing in partnership with AVPA to try and address some of this. Next one, please. So next one, please, Margaret. So for me, I think in order for us to talk about mental health and mental wellness, we have to really start talking about what was happening in our continent and our country even before COVID had come in. I've been working in this sector for over 2 decades now, and we have already been saying that mental wellness and mental health is a huge issue in Africa and in South Africa, that we were already a society that was dealing with a lot of historical trauma, transgenerational trauma, collective trauma, that had impacted wounding at a number of levels, from individuals, we saw it in families, we saw it in institutions and how people interacted in institutions and even at a societal level. And we were already talking about the importance of addressing mental wellness, because our crisis was that as a society, we're a people that were asleep to ourselves, to our emotions, to our psychological states, and how it was impacting us and our society. So when COVID came and hit our country, those of us in the sector just knew that the situation that we had was going to be exacerbated by COVID, and the impact that it was going to have in significant areas of our lives if we don't consciously ensure that we deal with our mental well-being. The fault lines that we already have as a society were going to deepen. And unfortunately, the very same human and social capital that we would need to build the society post-COVID would be depleted and deteriorated. So for us, really focusing on mental wellness is no longer a luxury, but a necessity in order to help us respond appropriately to COVID, but also in enabling a society to be able to build itself after COVID. So if we can just go and just the next slide, please. So some of the things that have just been emerging for us that have highlighted how COVID has exacerbated the mental wellness and mental health in our context is just the way our responses to COVID-19, such as people being quarantined, lockdown, has actually fueled some of the psychological issues such as isolation, loneliness. Here in South Africa, some of the communities told us just that the presence of the police and the army in the communities, which our government has decided to bring in order to try and help us to monitor compliance, triggered their previous trauma during apartheid. So already just the responses alone to COVID do the opposite at a mental health and mental wellness state. At an individual level, we've talked a lot about how people have experienced fear and anxiety. We have been really concerned about the people who are leaders and managers at the forefront of dealing with COVID, because most of...
Have we lost her? Nomfundo?
Yeah, I think her internet might have cut out. So Namfundo is actually on the road. Why don't we go ahead, maybe Olaide, maybe you can sort of step in, because I'm not sure if we'll get Namfundo back on the line. But Margaret, why don't we go ahead to Olaide's slides, and we can come back if Namfundo is able to join us back. So sorry for that, everyone who's joined us, but yeah, we'll try to come back to Namfundo. Hopefully she'll be able to join us back. For now, Olivia, please welcome.
Thank you so much, and thank you so much for having me here. I'm very excited to be joining the conversation, especially because I'm going to be talking about dyslexia, which is something a lot of people don't know has a lot to do with mental health. I work with Dyslexia Nigeria, and we work with a whole range of stakeholders on dyslexia. So we work with workplaces, schools, individuals on dyslexia. And many people who may not know, dyslexia is actually a specific learning difficulty. It's a difficulty that is of neurological origin, which means you're most likely born with the gene that makes you dyslexic. And what dyslexia is it's a difficulty with all of the skills that are required for literacy, so reading, writing, and spelling. And that happens with normal to high intelligence. So it has nothing to do with intelligence. It's just the way the brain processes information. And this is really important because 20% of every population is dyslexic. So approximately 40 million Nigerians have dyslexia. And you know, many people think about dyslexia and say, well, as a learning difficulty, it must be limited to schools and children and learning. But because it's something you're born with, it's a lifelong difficulty. And that means that it carries on into adulthood with different symptoms. And that's what we're really going to be focusing on today. So those symptoms, they typically affect executive functioning, and that's really things to do with your working memory. So how long can you hold little bits of information for and then use them for thinking? It affects organization, it affects concentration, and sort of how long it takes you to be able to think through certain problems. And so this can have a really, really strong impact on everyday life and living and working as well. And so you think about things like poor time management. People who are dyslexic struggle with meeting deadlines, for example, being able to structure their time, knowing how to sequence tasks, planning to-do lists. You know, with the difficulty with reading and writing sometimes, it means they have to read text over and over again to be able to get proper understanding. It can be difficult to multitask, manage a very heavy workload. It can be difficult following instructions, you know, holding more than 3 bits of information at a time, and writing as well with grammatical accuracy and a lot of speed. And if you notice, these are things that are with everyone, and they're skills we need to function in every type of job role. So you can imagine what the COVID-19 situation brought, you know, people having to work flexibly, having to work from home, and meaning that there are lots of distractions, there are kids at home, there's grocery, there's electricity, there's Wi-Fi problems, and also because people cannot start and close work, you know, at regular hours that they're used to doing. It means so many people are working around the clock. So the pressure on having to cope with, you know, being organized and staying on top of a to-do list and multitasking, it becomes a lot. And what we've seen at Dyslexia Nigeria is so many more people have been able to go through the signs and symptoms of dyslexia and realize, well, actually, I'm struggling with organization, I'm struggling with concentration, I'm struggling with juggling all of these tasks. And without the appropriate coping mechanisms, there's a lot of strain on mental health. So people get frustrated, there's anxiety, there's panic, they're not doing as well, they're falling behind, they're struggling with new targets, new working environments in their homes. And that's meant that so many more people need support. And that's really where the link between dyslexia and mental health is. Can I go to the next slide, please? Margaret. Next slide, please. Thank you. So having seen so many more people come forward to say, well, I'm having these difficulties, what can you do? What we've then done is we've conducted a lot more diagnostic and workplace needs assessments. And what that really is, you know, we have a rigorous process where we examine and assess someone who might show those signs or symptoms, to come up with a profile of strengths and weaknesses, and to say, well, going through all of these tests, are you really dyslexic or not? And what can we do to help you? What sort of coping mechanisms can you put in place to better manage some of what you might be having difficulties with? So with that, what it means is we've done a lot more of awareness. So if you follow us on Instagram, follow us on Twitter or on Facebook, you'd have seen a lot more about the signs and symptoms of dyslexia. How do I know I'm dyslexic? How do I know my child is dyslexic? How do I know my colleague is dyslexic, or my employee, or my manager, for example? And what does that look like in everyday life? Having done that, we are online 24/7 for you to book a consultation, 15 to 30 minutes to have a conversation with one of our experts to say, well, I feel like I have these signs, what can I do next? And then we can have, more of a conversation with you about what your work situation is, or your life situation is, or study situation is, and maybe what your kids are going through. Spending time with them at home as well in this time has meant lots of parents have also been able to see where their kids are struggling. And so brief consultations can then lead into assessments where we can properly diagnose dyslexia and come up with a profile of strengths and challenges, and then recommend strategies and support, signing up onto a therapy program that allows you to put in place strategies that help you cope better and improve your mental health. So that's what we've been doing, especially during COVID-19. Next slide, please. Thank you. So what have we learned? I mean, there's so many things that we've learned, but I'm just restricting it to two main things we've learned now. The first is, in our environment, there's no legislation that actually protects the needs of people who have specific learning difficulties, like dyslexia. So whereas we have people who think about disabilities or challenges as something that they have to look after by law, we don't have any legislation that currently covers that. So we've had to do a lot more work to create awareness of what dyslexia is and how prevalent it is. There are 22 million working Nigerians with dyslexia. There's at least 3 kids in every classroom that is dyslexic. So everyone needs to have an idea of what it is and how prevalent it is, and how easy it is to put in some reasonable adjustments that make people with these difficulties to excel. So that's something that we've learned, that we really have to engage and create more awareness to let more people know about dyslexia, and to see it's not a disease, it's not anything to be ashamed of, it's just something most of us have that we need to manage. And that also has lots of strengths, so most people with dyslexia are highly creative, they're great entrepreneurs, they're great at idea generation. So many people that we know are successful are actually dyslexic. Steve Jobs of Apple was dyslexic, Winston Churchill was dyslexic, Will Smith, dyslexic. So many people, Richard Branson, people who are so successful, and that's because they've been able to find strategies to cope with dyslexia and have a much better, healthier approach to it that helps them succeed. The second thing we've learned is that subsidy is actually very important. So on a normal day, if people recognize that they have challenges like this, they're willing to put funds towards it to get support. But with the pandemic, what happens is, demand becomes elastic. There's so many other things that people want to put money to. They're prioritizing the basics of food, water, shelter, and many people are not thinking that they actually need to invest in their mental health. But without investing in that, everything else you're trying to put money towards suffers. So if you can't focus at work, you can't multitask, you can't keep on top of your workload, the likelihood that you can keep your job is lower. So you really need to be able to invest in your mental health. What that means for us is, we've realized subsidy is very important. We need to be able to get funds, therapy that they need to cope with dyslexia and cognitive challenges. So needing to be able to meet people halfway and perhaps part fund the cost of training is something we've learned that's very important. May I go to my last slide, please? Next slide, please. Thank you very much. So that just flows right into the help that we need at Dyslexia Nigeria. We are currently raising funds to subsidize the cost of diagnostic and workplace needs assessment so that more people can afford them. And that means more people can take it on, even as they have to put their regular salaries and paychecks to basic needs. We also need avenues to create more awareness, so avenues like this where we can speak to a lot of people, but also opportunities with mass media engagement, television, radio, whatever platforms there are that we can speak to a lot of people, to organizations, to parents, to employees, to schools, to the government about dyslexia and the fact that so many of us have some slight challenges with processing information just a slightly different way, and we need some help. And leading to that, we need subsidy for therapies to be able to help people afford, going on therapy for a while to improve working memory, to improve concentration and organization, and basic skills that we need to properly manage our lives and our workload, and in that regard, improve our mental health. That's it for me. Thank you. That's I hope I kept to time. I know time's very important at the moment.
No, thank you so much, Lydia. I think you made some really important points about how this is really part of everyday life, and despite the fact that maybe it's not as recognized as it should be, particularly in the regions where we're working in sub-Saharan Africa. I see Nomfundo has joined us back. Nomfundo, are you available to sort of pick up where you left off? I know we lost you and you were making some really fantastic points. Nomfundo, I will
yeah. Hi guys, yes, I'm here. Sorry about that.
Great. Okay, so Margaret, maybe we can just go back to Nomfundo's slides. And yeah, sorry about the connectivity problems there. Feel free to go ahead and maybe pick up where you dropped off.
Yes. So what I was then just saying really was that our COVID-19 has exacerbated the situation concerning both the human and social capital that we're going to need, both to respond to COVID-19, but also to rebuild our societies after COVID-19. And I think for me, what the most important thing that we need to get out of this meeting is for us to begin to advocate for the importance of highlighting mental wellness as no longer just a luxury, and it's not even a necessity, but it's a critical component of the fight towards ensuring that our societies are able to survive COVID-19. The next slide, please. So just in terms of our responses, we were called in by the African Venture Philanthropy Alliance through Frank to start a mental wellness initiative here in South Africa. So we've started this and we are working with people across the country who are working on mental wellness issues. And the idea for us is, first of all, to really advocate for the prioritization of mental wellness in our country, considering the appreciation of the context that we were operating in prior COVID-19, the current context, and just the importance of the mental wellness of our people, our leaders, and the institutions that we will be working in if we are to survive the scourge of this violence. So really advocacy has become an important thing. And for us, the reason advocacy is also important is about enabling us as mental wellness practitioners to know how to build a business case for mental wellness. Because for us, it makes sense, but for people who are really critical at ensuring that our country recovers, they don't understand why it is so important. They don't fully appreciate the extent of the damage that has happened at a mental wellness level for our society. So how do we then begin to bring people who don't speak the same language as us, but who can help us to translate our language so that those that have the investment, that are making the decisions, are able to prioritize mental wellness. And so advocacy really becomes important. And what we are also doing, what we're finding in South Africa is that for the past decades, there is so many of us doing great work, but we are sufficiently coordinated, and if we are to deal, it be crucial that we upscale mental wellness initiatives. We come with creative ways of how do we enable collectives and societies to facilitate healing at large scales. So some of the interventions that we are having that I just want to speak to and then I close is, for example, we have prioritized working at schools. Our schools are reopening. The principals as leaders are themselves stressed. The teachers are stressed. The students are stressed. So how do we really collectively as a sector ensure synergy, but also ensure that we upscale our initiatives? We've also focused on leadership. I think sometimes when we do these initiatives, we underestimate the importance of those in leadership to be able to deal with their own trauma. And when we talk to them, we really encourage that they do leadership coaching, they do leadership support. Because when these leaders have these levels of burnout and they go out there and they lead from the space of being wounded, then we are in trouble as a society. The final area we're focusing on is working with frontline workers, but also again specifically on some of the people who are making very tough management decisions around mental health. So I think just in closure, the last slide, please. What I just really wanted to highlight today more than anything is the advocacy part, that for us as Africa, our greatest resource, and even South Africa, in relation to responding to COVID is the people. And therefore we need to begin to talk about investment in human and social capital and dealing with mental health and mental wellness as a critical component of that investment. Because I think that's the language that those who are investing in COVID-19 really understand. We need to get out of our rooms and one-on-one counseling and come up with creative ways of helping our societies deal with this collective trauma that is actually impacting historical trauma. So thank you for having me, guys. That's all.
Great. Thank you so much, Nomfundo. I'm glad you were able to join us back despite the connectivity challenges. Nomfundo might not be able to stay with us for the entire webinar. So we'll try to keep her with us as long as we can. Before we go to our next speaker, we're just going to take a quick pause to run a second poll really quickly. And what we want, and we heard some of these challenges addressed by our first two speakers, but we really want to understand from you, from our audience, why you think mental health remains neglected as a health concern, specifically for Africa, because we know that this is not very well. There's a lack of awareness. There's a lot, maybe social stigmas associated. Maybe there's a lot of misinformation floating around. So we just want to hear from you where you think some of the challenges are. I think when people like Nomfundo talk about advocacy, I think it's important to understand what are we advocating for. So we'll give it maybe another 5-10 seconds. So please go ahead, put your responses in before we share this. So thanks. A lot of people have already put in their responses. We'll give it another 3 seconds. Quick, put your last answers in. And let's share this. So social stigma is a very, very real issue, sort of overwhelming. Looks like 70% of people are saying that's a social stigma associated with mental health. There's a real issue. And very closely related to this, around a lack of awareness relating to signs and symptoms of mental health distress. So thanks everyone for your responses. And my colleague George is telling me on the line that in case, I know most of the people when we took the first poll said that nobody said they needed help, but we do have some resources that we'll share with you guys in case or some of your colleagues do need to talk to someone. And I'll let George sort of post that information in the chat, and we'll circulate that also post the webinar. So thanks so much for your feedback on that. And I will hand it over to Bright, who will be our next speaker. And Margaret, if you can go ahead to Bright's slides. Bright, I'll hand it over to you.
Hi guys, hope you're doing well. I'm really excited to be here. My name is Bright Shitemi. I'm the founder and executive director of Mental 360, which is a youth-led, youth-focused organization that raises awareness on mental health and supports young people and the wider community by offering holistic and affordable solutions in therapy, physical wellness, and art therapy. So next slide, please, Margaret. Yeah, so in the COVID-19 period, we've been offering online counseling and telecounseling. This is where people are able to reach out to us via our helpline number. If you look at the poster on the right, you'll see our helpline number, which is 0776 543 099. And anyone can actually reach out to us from anywhere in Africa. If you just put at +254, the country code for Kenya, you'll be able to access therapy services. We have a social enterprise model where we ask people to pay what they can afford. We take them through a screening process to be able to ascertain what their economic situation is, um, and then customize a package for them. And so we also do referrals through our helpline for people who are in need of maybe police intervention, food donations, economic economic strife or difficulties have been a big factor during this period of COVID-19. We also do hospital referrals to those who need hospitalization. The other thing we've been doing is virtual support groups, where through WhatsApp and online platforms, you'll be able to interact with people who are living with mental health challenges, who get to learn from each other. And all this is being overseen by our group of psychologists. We also do webinars, and this is one of them, with companies, with individuals, young people in community. And we are looking to someone who should be on mute, please. Yeah, we are looking to, with resources, go into SMS-based psychological first aid training. We see the need to devolve not, let me not use the word expertise, but the know-how on how someone or a lay person can deal with someone who's going through a mental health challenge. And especially with pandemics such as this, it's possible to move these trainings to SMS-based for the people who are not online. So the other thing we've been doing is a lot of awareness on our social media pages. Please check us out on Facebook, Instagram, and Twitter. You'll find all those handles on our website. Next slide, please. Yeah, so what are some of the things we've observed during this period and learned? Number one is that suicide and suicide ideation rates are increasing. Already, suicide has been a big challenge the world over, with it being second leading cause of death among young people between the ages of 15 to 29. And for us, Mental 360, we target people between the ages of 15 to 35. Um, and so in the last decade, as of 2019, the suicide rates had gone up by 58%. And in the COVID-19 period, from the calls coming in, almost 60% of the people who are reaching out are people who are actually going through suicide ideation at this point in time. Number two is an increase in sexual and gender-based violence. Again, as of 2019, we already had a crisis in Kenya with about 380,000 Kenyan teenagers, having gone either rape or sexual exploitation, and having to bear children at a very young age. There was a new article in the papers yesterday where we had really astonishing numbers coming out, uh, where these crises has again doubled, even tripled. And then we have number three, where we have a lot of relapse from people who are already living with mental health challenges, the people who are struggling with substance abuse, anxiety, depression, due to the situation with the lockdown and quarantine conditions, and reduced access to mental health professionals and medication. A lot of relapses have been seen. Next slide, please. Yeah, and some of the learnings you're picking out as an organization from these, and some of these issues you're already working on, is we see a huge gap for mental health app. And Nomfundo just talked about how do we move out of one-on-one sessions, on how do we then transfer the power or knowledge to someone who's going through the challenge. And technology is going to be a key resource moving forward. And in the African and especially now for us Kenyan context and the people we are targeting, the youth, we see a huge need for a customized mental health app for the needs of the youth. And this is something you're working on and you're looking to get more partners and support to get it accomplished. Number two is the key reasons for poor mental health among the youth in Kenya are trauma. These are rising from experiences either from childhood, a lot of sexual exploitation and violence issues, and economic related stresses. And so for us moving forward, we see that any awareness work done or anything done towards mental health should be coupled with, and I'll mention this later, with economic empowerment and filling the information gap by raising more awareness. And we see, again, as I mentioned earlier, doing SMS-based trainings will help, especially in periods of pandemic. Next slide, please. Yeah, so what do we need to scale as an organization and as organizations working in mental health in Africa? Number one, as I mentioned earlier, we see a need for contextualized mobile phone app. These will need a lot of financial support and technical expertise. Number two, as an organization, we need more investment in human resource in our programs. For example, with therapy, at some point, then you get overwhelmed because there's so many people who are in need of support, and you have less resources in terms of human resource to meet these demand. We also see a need for professional mentorship. Being a young organization led by young professionals would really benefit a lot from mentorship from our peers. I mean, our people who are more experienced. Number three, we see a need in investment in scalable awareness platforms. And Mfundo has just talked about also getting out of the one-on-one sessions to reach more people and rich communities. And we see the use of art as a powerful tool. Please mute. We see the use of art as a powerful tool to reach out to actually to global levels. And so in this, we are working on a festival. We had the inaugural event called Cradle Arts Festival. Please look it up. It's actually using poetry, music, theater to discuss social issues, to discuss mental health, and raise awareness on a global and powerful scale. And so for this, we will also need a lot of financial support, networking, and partnerships across the continent and across the world. Last slide, please, Margaret. Yeah, so feel free to reach out to us. That's my personal line there, 0710 256 888. As I mentioned earlier, our helpline is +254 776 543 099. Anyone can reach out from anywhere. We'll be able to offer phone counseling. We'll be able to offer Zoom or Skype counseling in this moment. And our website is www.mental360.or.ke. Thank you so much.
Fantastic, Bright. Thank you so much. And especially thanks for the contact numbers. I know that some folks were asking about that in the chat as well. And we've had some good questions come in, Bright, so I'll come back to you shortly for those. But for right now, I'll hand it over to Dr. Wanjiru Kaigwa as our last speaker, and then we'll come over to Q&A. So Dr. Wanjiru, the floor is yours.
Thank you, and thank you everyone for joining us today. Such a privilege and an honor to address you as we discuss mental health and well-being in COVID-19. So I am the lead resource mobilization in the National Business Compact Against Coronavirus. This was
Sorry, Dr. Wanjiru, your voice is a bit soft. If you could maybe just move a little bit closer to your speakers or just speak up a little bit. We're having a hard time hearing you.
Oh, okay. I'm sorry. Can you hear me now?
Yes, that's much better. Thank you.
Oh, okay. So I'll take it from the top. Thank you so much for having me. And as we discuss this mental health and well-being in COVID-19. So I will be approaching it from a multi-sectoral approach towards building resilience, both for individuals and for the society. I am the lead resource mobilization that was established March 16th and is a coalition of players in both the health sector, the public sector, the corporate SDG, the Rotary. We've just been joined by someone from the Rotary, and several corporate organizations who have come together or convened under the MSK to give a business response or to respond to the COVID crisis. So my bias is towards mental health and digital. Next slide, please. So I'd just like to paint a background of where we are, informed by where we were with the Spanish flu, and 4 waves were seen at the time of the Spanish flu, and 4 waves are being seen now. And this corresponds to the increase in morbidity and mortality, which is the death and illness resulting from, one, the illness itself. That will be the first wave. So you have death, at the moment, morbidity and mortality from illnesses that have been neglected. As it were, there was a very high incidence of non-communicable diseases. So this is particularly diabetes, cardiovascular disease, chronic obstructive lung disease, and cancer. So there was already a very high rate of death from these illnesses. And what you have now is that patients are avoiding going to hospital, fear of the virus, or because they do not have access. And as a result, you have decompensation. So for a patient who was being managed for diabetes, they have not been going to hospital, so you'll have deaths resulting from these. Patients who had kidney disease have not been attending the dialysis sessions. Patients who had cancer and have not been getting their chemotherapy sessions. Patients who have hypertension and now present with stroke and sometimes death, unfortunately. The third wave we expect to see is the effects of malnutrition and undernutrition, issues of food security because of access, because of the economic situation arising from this illness. And then finally, we have the mental health effects, which is what brings us here today. So we will have mental health effects from both a combination of the three, which is the factors that are brought about by this wave, as well as the psychiatric implications of the illness. So as it is now, it has been documented that there have been psychiatric manifestations of COVID-19. After the Spanish flu, there was actually an uptick, not only because of the stresses that these diseases caused, but because of the physiological effects of this illness on the brain. There was a need for more, at the time they called them asylums, but they are mental health facilities. And so mental health, as we look at it, is a spectrum, and is actually affected by a lot of external factors, as Bright and as Nongupo highlighted earlier. So for us as the National Business Compact on Coronavirus and the partner organizations that are under us, we're looking at mental health as in a much broader perspective, as opposed to just one person's illness. Just to explore mental health on its own, I'm just going to broadly categorize 3 categories. So in the first category, we have people who have psychiatric manifestations of illness. So we have people who have depression, we have people who have anxiety disorders, we have personality disorders, we have bipolar disorders, mood disorders, and schizophrenia. So that is one category of people who are already had psychiatric manifestations and either were or were not getting treatment for these illnesses. As Bright highlighted, that there is a large group of people who were not already receiving treatment for illnesses that they had. So already we can just pack that as what was already happening and will probably continue to happen, as well as the ones who are not continuing to, who stop getting under care but will stop receiving care because of the effects of COVID. So in our second category, we have people who are predisposed either genetically or because of a background of trauma to mental illness. So let me give you an example. You might have somebody who's genetically predisposed to schizophrenia, but has never had a trigger. And so what COVID has now presented is a set of unique circumstances that can act as a trigger for somebody who otherwise may not have been triggered towards illness. A woman turning 30 in the time of COVID might act very differently from a woman turning 30 before COVID. They both may have had a predisposition to bipolar disorder, but somebody who is reaching a milestone, triggered by the circumstances into an illness that they previously did not have and they necessarily did not have to develop. The third group of people, which is where the large population falls, is the people who do not have a background of trauma or do not have a background of genetic predisposition to mental illness and have not had psychiatric manifestations. And so for this group of people, which is actually the larger population of people, you want to prevent them falling either into negative patterns, alcoholism, drugs, aggression, and suicide. And so this is a group of people that the intervention that you do for this group of people is very different from the intervention that you would necessarily have for the first group of people who have psychiatric manifestations and the second group of people who have a predisposition. There will be some overlap, but how you look and address all of these three groups is different. Now, for the majority of people, we have to think about safeguarding the most vulnerable. So even in this larger group of people, there will be, and as it turns out, men are actually the most vulnerable. Already before COVID-19 came, suicide was one of the leading causes of death amongst men. And Africans, unfortunately, because of their limited resources, also had a higher predisposition to poor coping mechanisms and mental illness. So as we look at that, we have to think broadly about dynamic interventions for each of these three groups. Now, I'm just going to move on to what we are doing as the NBCC and as our partner organizations. Next slide, please. Yes, so communication. One of our biggest interventions has been communicating about the illness and ways to prevent it, personal protective measures, and providing a means to do so by providing hand washing stations and reducing stigma because of the illness. Then we have one of our partners, the AMREF, is implementing mental health care through training of community health workers. We're also working with the Ministry of Agriculture to enhance food security and to communicate ways of coping that also include interventions in taking control, such as planting gardens, kitchen gardens. And then finally, we have what is in the pipeline is a helpline by the Rotary. And this is going to be a toll-free line with medical workers. And I'd like to emphasize the importance of community health workers in this whole dynamic, because a lot of people are not aware that they need mental health care. So why it's important is because it generates demand for health care services. For example, antenatal care services. You have a woman who's expectant, but she doesn't know that she needs antenatal care. So a community health worker communicates the importance of, say, antenatal care, and this woman now becomes somebody in need of the service. So she generates, I understand that they need this service unless it is communicated to them, unless somebody identifies them at the grassroots level that this is a problem, they may not approach anybody for help. And so in all these interventions, actually, we are still scaling, still learning, and still wanting to learn and share as much as possible. Thank you.
Fantastic. Dr. Wanjiru, did you also want to mention on the last slide? Go ahead.
I think I covered it before, okay. So supporting all of these things, yes.
Super. Okay, thank you so much, Dr. Wanjiru. And once again, thank you so much to all of the speakers. We've had some really fantastic questions come in, so please go ahead and putting them in the chat box. I will start with Olaide. There have been several questions, Olaide, that came in around dyslexia in the workplace. So questions around how do you work with colleagues who have dyslexia? What happens if it's not addressed in the workplace, and sort of what can people do to help? So I think it sort of people want to know if, you know, how does that affect people in the workplace? How do you deal with colleagues who might have dyslexia in the workplace? It would be great to hear from you on that.
Yeah, thank you so very much. I've seen some of the questions on the chat and I started responding to some actually. I think that they're absolutely exceptional questions and really things that everyone who thinks about this needs to ask. The first thing, I think what I'm going to do is answer them together because they're two sides of one coin. The first side is what can you do if someone near you is dyslexic in the workplace? And the second one is what can you do if you are dyslexic in the workplace? And that's sort of the way I look at the question. But if anyone would like me to explain anything any further, I'd be very happy to. So basically, I start by saying, well, I'll just give a brief context as to what dyslexia can affect. And then when we look at the different areas that it affects, we can then look at things that we can do to support people who might be dyslexic, but also what you can do to get help. So the first one I mentioned briefly during the presentation is people who are dyslexic likely have a challenge with working memory. So being able to hold information for a few seconds in the brain and then use it, manipulate it, and use it for thinking. The second one is processing speed. So just the time it might take to arrive at, you know, an answer, a solution, a thought. It's not that the person doesn't know what it is, and it's not that their brain works slower. The way I would just describe it is, it's imagine taking a scenic route somewhere. So instead of jumping in the car and going from A to B, you decide to take a walk and go by the park and pick some flowers and then arrive at B, right? And then the third one would be visual stress. So some people with dyslexia experience words jumping around on the page. Sometimes white is a bit too bright. They might experience some blurring, shadowing of text, and all of those can affect reading, concentration, focusing, being able to write, express themselves properly on paper. And there's also the last bit, which is phonological awareness. So that's really looking at manipulating language to communicate what you want. And looking at how words themselves convey meaning. So sometimes mixing up words that sound alike. So whether W-E-A-T-H-E-R, the weather, and whether something is right or wrong. You can see sometimes people spelling the same thing different ways in a piece of text, and also mixing up what those meanings could be. So if you think about, you know, some of those areas as, the last one being automaticity. So learning something to the point where you can do it without thinking. And you can imagine the different ways that we need automaticity in everyday life. For example, with driving, when you learn how to drive and you're on the wheel, that's not the time you need to start thinking about, what goes first? Is it the clutch or the brakes? So when you think about the different spheres in which dyslexia can affect the way a person processes information, then you can think about how you can support someone near you who might be dyslexic. So we'll start with the mental health, emotional bit, which is please recognize that they are trying very hard. One way that we like to explain this at Dyslexia Nigeria is, imagine if two people have a bowl of spaghetti and everyone is used to having a fork where you just twirl the fork in spaghetti and you can pick it up and put it in your mouth. And some people who are dyslexic have a spoon. They're probably trying really, really hard to pick up the spaghetti with the spoon, but it'll keep falling off unless you can teach them a specific strategy of perhaps bending the spoon and then turning the spaghetti around the neck of the spoon. Then they can eat like everyone else. But until they have some support strategies, it becomes really tough for them. And they're putting in a lot of effort, actually, a lot more perhaps than other people who just have a fork. So please recognize that they're trying very hard. Don't bully them, don't degrade them, don't make them feel stupid or less than capable. They're none of those things. They just need some reasonable adjustments. Now, if we look at what working memory does, how you can help with if a person is struggling with their working memory, please give precise instructions. You know, don't go off saying this and then distracting them with something else and then coming back to another, instruction. Give exactly what you want to be done very clearly. Use very straight language, no idioms. People with dyslexia sometimes take things very literally, so you don't want to be using idioms as well. And you want to, give your instructions in small bite-sized chunks. So think about giving not more than 3 instructions at a time. Whereas other people might be able to hold 6 to 9 bits of instructions, people with dyslexia can manage about 3. So just stick to about 3 and encourage them to write down information. They come with you with a pen and paper, please let them write it down, or let them record what you're saying. If they're in a meeting, let them use and listen to it. It's a very simple, reasonable adjustment we can make. With processing speed, remember you don't want to put them on the spot, perhaps in a meeting, and just call on them to say something. Give them a heads up ahead of the meeting. I'm going to be asking you to explain what happened with, the numbers last week. Let them know what's coming, so they have time to have thought about what they want to communicate. You put them on the spot, they likely might just freeze, and then, it becomes embarrassing for them, it becomes embarrassing for everyone. And they do know what they're trying to say, they just need a bit more time. So give them some time. And also with writing tasks, they might need a little bit more time to complete writing and reading tasks, but also embrace technology. Assistive technology is so simple. A lot of it is free, and that helps people to get through lots of text. So you have text-to-speech software, speech-to-text software. Some already come with your computers. So I know Microsoft has text-to-speech. You have Grammarly that can help you. It's free. You can download it. That can really just help you go through the structure of what you're writing, suggest new ways to express what you're trying to say. So assistive technology is great. You can have dictaphones to record things and play them back. Find out what their preferred communication style is. Sometimes they would prefer if you just said things to them verbally, or if you showed it as a diagram visually, rather than give them a 50-page document to go through. That could really help as well. And then as an employer, you want to think about incorporating pre-employment screening during your recruitment, so you can identify people who are coming on your team that show some signs of dyslexia, and you can put in some reasonable adjustments to help them excel on the job. You could work with experts to do that. For example, we do that at Dyslexia Nigeria. We can do pre-employment screening for you, or teach you how to go about doing that. And for the individual themselves, what do you do if you recognize that, some of these signs you've seen, perhaps difficulty meeting deadlines, or concentrating, or multitasking, are challenges for you? What can you do? Know the signs of dyslexia, and then reach out to an expert and get a workplace needs assessment or a diagnostic assessment. The reason why it's important is because it helps you look at your profile of strengths and weaknesses, and that helps you know, well, what tasks am I really good at? What should I focus on? And what part of my job can sometimes bring about the areas that I have challenges with, so that you know what strategies you can put in place to cope day to day. And those are the things really, I think, on both sides of the coin that help people cope and help us realize that there's nothing to be ashamed of being dyslexic. And people forget things all the time, but we all have strategies. People sometimes just need help to put those strategies in place. And I think with that, on both the employer and the employee side and with colleagues, it can be really easy and very successful to work with and as a dyslexic person. And I hope that answers the questions.
Thank you so much. That was actually really insightful, very practical advice. I think that people can really, really implement in the workplace. And Bright, I'm going to come to you with hopefully maybe some practical advice with a slightly different set of stakeholders. So Philip mentioned, Bright, that Kenyan reports in Kenya suggest that about 4,000 teenagers have gotten pregnant in one country. And he's sort of asking what can be done for these girls who are undergoing a lot of social stigma. And, you connected that, sort of teenage pregnancy with mental health issues. Do you have any thoughts on how that demographic of people, how can they be assisted maybe specifically?
Yeah, I think the first thing that needs to be done for that is for the people who are responsible to be held um, legally responsible. That's the first step towards even healing for these girls who've been exploited. And second, there needs to be now probably safe houses, because some of these abuses are occurring within the home, where it is the guardian or the parent of the girl who's exploiting the girl. So we need to invest, and this is going to come from probably the government or some of these INGOs. Invest in safe houses where girls have an opportunity to run away from home if they are living in really adverse situations, and have a safe haven where they can get an intervention. So I think those two areas, first, with having policy where people who are doing these things are held, because in Kenya, we've seen so many cases of children being exploited, and the man or the people who are involved go scot-free. So that the message you're passing to the people, to the wider public, is you can do this and get away with it. And to the girl, the message you're telling her is you have no power, you have no recourse. So I think if those things are done, that's going to address the situation at this time. So the good thing is the government has data already. So that means they've identified individuals who have gone through this. So do we now go into the next step of investing in that? I hope we do that.
Great, great, right. Thank you so much. Thank you so much for that. And I see a question from Kristen that's slightly related, and I mean this is sort of open to any of the speakers, but her question is coming from institutions, right? So how do, for instance, places like Mathare Hospital in Kenya, how do these institutions protect workers and clients despite the fact that they're underfunded? Are they do you know if they're receiving any type of support during this time, from either public institutions or private institutions? So just wondering, especially during this time, institutions that are housing people, how are they coping and managing during this time? And that's open for any of the speakers, if anyone has thoughts on that.
Okay, maybe I could respond to that. As far as I know, there hasn't been much of an intervention in terms of mental health facilities. The government did put out a statement on mental health, just guidelines on how to manage it, especially around COVID. But in terms of investing in the infrastructure and the healthcare workforce, there hasn't been an investment.
Okay, so definitely an area of need then for that. Nomfundo, I'm not sure if you're still on the line with us, but I saw that you were also sort of responding to some of the next question, but I'll leave it open to any of the speakers as well. There were several questions sort of coming in from Safia, from John, really looking at this from some sort of a place of collaboration. How do we create an ecosystem of collaboration for sharing resources across the continent? I think this conversation is one way that we can sort of start that. So that was Safia's question, how do we create that ecosystem? And John's question, which was very related, was, how do we leverage on existing programs and systems to really accelerate what's working? Would be keen for any one of you, of the speakers. I know Nomfundo was sort of mentioning on the chat, but if she's dropped off, would be welcome to hear from any of you.
Yeah, maybe I can just speak on that also briefly. Using the Cradle Arts Festival that I just mentioned earlier, we want to have it as a platform where we are raising awareness on a continental level about mental health, but also using it as a call to action to create a mental health marketplace. So we are actually in the process of collecting data on organizations across the continent, where people can then in one place go and access some mental health resources. If someone is coming in from Rwanda, they can go on the website and see what organizations or what interventions are there in their communities that they can reach out to. Or if they're not there, what is happening in another country that I can use technology to reach out to. So that's one of the things. The other thing is, I think that needs to be done is partnerships. We need more partnerships as mental health organizations. to merge our ideas and make iterations to our approach and come up probably with a singular approach that's then impactful and is cross-cutting across all segments. I know that's a huge challenge, but that's something that I think through persistent efforts you're going to get to.
Great, thanks so much, Bright. Dr. Wanjiru, I want to come to you with the next question. We had some really interesting questions from a couple of folks on sort of the connections from mental health to other societal issues. So there's a question from Kristen again on, is there a relationship of mental health during COVID and sort of the race issues that we're seeing happen across the world and not just in the US, you know, the Black Lives Matter riots. There's another question very closely sort of related saying, how are we linking gender-based violence with mental health? So clearly these, you know, are these things interrelated? And if so, sort of how do we work on addressing things that it's a complicated issue, right? So how do we look at it from all these different facets?
Okay, thank you for that question. I think I would look at it from two different perspectives. So for one, we're building resilient communities. And so resilient communities are communities that can stand in the face of various traumas and still not be devastated by them. And one of the things that are a key element of building a resilient community are justice, equity, and equality. So as you look at it from a community perspective of the collective trauma that may have resulted from, you know, for example, in the case of the Black Lives Matter movement and the racism conversation there, you have years of systemic racism. And so you have a community that has collective trauma, so to speak. And even to bring it back home a little bit, as Africans and as Kenyans specifically, we have, you know, this racism, inherited racism from colonialism. Then we have racism from how we have felt, our interactions with our leaders and how in the ways in which we felt disappointed or let down. So there is that element of like a community building systems that make the community more resilient, make the nation more resilient. This will be based on interventions that generally make it a more just place to live, more equitable, and where the disparities are not as glaring as they are now. And then now I would like to move it down to what is essentially the individual level of how do you build resilience in an individual. So just assuming that the situation does not change, the context does not change, how can I as an individual face what is essentially a time of difficulty and a time of hardship and come out with my mental health intact? And so that is a very different conversation from building resilience for community. And this now is where we have the 7 C's of resilience that include coping, control. And because we have not traditionally been taught how to cope as part of, you know, learning, we kind of have to have a crash course on how to cope with difficulty. And so this is where it's important now to have, for example, the intervention of community health workers or one-on-one coaching with people and to start to reach into each other's lives to promote better coping mechanisms, to promote, you know, better health, mental health practices around this. And sometimes because digital is a double-edged sword. So because of digital, we have an increase in anxiety because now you're so acutely aware of what is happening in the world and it affects you deeply. You, at the click of a button on your phone, you can just go online and see, oh no, you can literally watch the entire murder of a man right before your very eyes. But digital is a two-edged sword because on the other hand, it is a place for healing. You have all these resources that you have access to and that you can, if you are purposeful about it, you can start to access materials that, you know, help your mental health. You can seek out information that makes you better. Now this is for an audience such as ourselves who have access to this technology, but there are people who don't have access to this technology, and these are people in the villages who are still facing this, and that's where community health workers come in. And these are community leaders, they're well known in the community, and they can go home to home, identify what are the challenges. They can identify this is a stressed environment. This is a place that has anxiety. They might be able to identify abuse. So on that ground level, we have to also strengthen those systems on a very basic level of the people who come into direct contact with the general population.
Thank you so much. That's fantastic. I actually want to tie some of your comments and sort of throw this back to Olaide. There have been several questions around how we can reach families for early intervention, and there was another question specifically about how, you know, if you guys are working specifically with corporates on raising awareness. So again, sort of how are we addressing that as this a systemic issue? How do you reach families for early detection and awareness? How do you reach corporates for detection in the workplace? I don't know if you have any comments specifically on that for your work with dyslexia.
Yeah, absolutely. Thank you so much for those questions. We absolutely are reaching families for dyslexia, and we do that in a variety of ways. So we work with schools. So we most likely are in contact with your school, or your school can contact us. And that way we can reach parent-teachers associations, all the parents, we reach staff. We go to schools to make awareness presentations. So even children themselves can identify whether or not they have some signs or symptoms. We work with the government. So we're currently working with the government on how to get more awareness into schools and universal screening into schools as well. Again, early detection is very important. The earlier you can catch it, the earlier you can teach people how to cope with dyslexia, and then it doesn't become a challenge throughout the rest of their lives. And with corporates, we absolutely do work with corporates as well. Like, you know, our conversation here has gone. There's so many adults in the workplace who are also struggling. We do awareness presentations in organizations. So we just go there and have a really brief 15-minute conversation with all your staff about dyslexia and answer questions. But we also provide training. So we can have more in-depth training on dyslexia in the workplace. What are the signs? How can you cope, etc. Beyond that, then we do assessments, diagnostic assessments, and workplace needs assessments. So the more in-depth assessment then to develop the profile of strengths and weaknesses, and also to show how you can cope specifically on the job that you are in. We go to churches to create awareness in churches. I know that many people who might not be in school or in the workplace might also be in churches. We're there as well. We go to mosques too. So really where there is a gathering of people, because dyslexia cuts across all ages, both genders, it cuts across, you know, all different ways that we categorize ourselves, religions and all whatnot. So when different places that we can reach people. And, you know, we encourage people, you know, dyslexia happens on a spectrum. You don't have to be, you know, on the far extreme of dyslexia to suffer from some of the challenges that it brings with working memory or organization or attention. And so if you feel that you are having some of those signs, it is worth checking, am I dyslexic? Or beyond that, to just come along and have, you know, some working memory training or attention programming. We have some therapies we can work with you on to just help to improve those parts of your executive functioning, whether or not you think you are on the far extreme of dyslexia or not. Same goes in terms of awareness with going to hospitals, because some people do think dyslexia is a medical issue. They might be in the hospitals. So we're in hospitals too to say, you know, if you see this signs, this is not a medical issue. It's a learning issue. It's a way the brain processes information, and there's so many ways that we can help.
Fantastic, fantastic. Thank you so much. And I'm going to come to Bright, but in the interim, if anyone from the audience wants to contribute anything, please just put your hand up or message in the chat box so that we can unmute you and come to you. But we would welcome some comments, you know, from the audience. If anyone else has experience that they would like to share from their work, you know, there's some really interesting side conversations, and that's why I want to sort of give the floor to Bright here. There was an interesting conversation around sort of technology and access, and a couple of webinars ago on this series, we had one specifically, you know, looking at access to information, and there's a whole challenge around access to internet. And I know, Bright, you sort of mentioned in the chat that mobile penetration for Kenya is 91%. But I mean, we're sort of having a Pan-African conversation here, and that might not be the case across the continent, right? So, you know, when sort of social distancing and all of this is an issue, sort of how do you reach a population, and if they might not be, they might not have access to the internet. So you're focusing on SMS platforms or sort of, you know, low tech versions. And someone else brought up, John brought up the question, Bright, around, you know, different approaches and technological systems that can help address some of these mental health issues. So, so Bright, maybe do you want to just give some remarks and thoughts on sort of the enablement of technology to assist some of these things, and what you see working with Mental 360 that you think might shed some light?
Yeah, thank you, Ariel. Internet penetration is very low, especially in low-income communities. But the beautiful thing with Kenya, for example, is the penetration for mobile phones is at 91%, and across Africa it is at 83%. And so it's very possible to reach all communities through an SMS platform. So if you can recruit community leaders who then go through a training to be able to offer psychological first aid and be the first point of contact within a community, it is a model that can really work well. So that for any severe cases that need referral, they either refer to a community center, or they know they have a helpline that they can call to get intervention for those who are offline. Also, I talked about this app that needs to be contextualized to the needs of Africa or the needs of people in low-income communities. And so one of the things we are having on the app is an offline, so that you don't need internet to be able to access. Now, when I'm speaking about, and I know this is a bit in line with Mentor 360 as an organization, because we are targeting the youth in Kenya. We have, I think that the figures were over 80% of youth who are using smartphones. And so when they're using smartphones, they don't have data, they can't access the internet. We have an offline mechanism within the app that they can access basic information on mental health and referral pathways. So those are some of the things we're looking at, and we'll need a lot of support and expertise to actually make it real, or to make it a reality.
Fantastic. So really, it seems to be a very common thread around this sense of community. How do you really engage at a community level, at a really system-wide level to address this? And I realize we're really running out of time, but the last question that I'm going to ask is actually from Frank, which is a fantastic question, I think, to sort of close with, is, you know, how differently are mental health issues surfacing in Africa that are different from other parts of the world that we've seen? And I mean, how in this sense, sort of how are we unique? Bright, you've been talking a lot about the youth and teenage pregnancy. You know, I mean, just and I'll open this to any one of the speakers, or if you all just want to take a quick, you know, 30 seconds to give your comments there, and then we'll start to wrap up. But I think it's interesting to look at this in the context of, this is a global issue, but I think it's affecting those of us, you know, in Africa very differently.
Okay, I could try and respond to that. I think a study was done by the University of Nebraska that was looking at online sentiments post-COVID and post the lockdown, and looking particularly at online sentiment in the US, and seeing what are some of the things that stood out as a result of COVID. And there was a peak in drug abuse, there was a peak in misuse of opiates that are traditionally for pain. There was an increase in alcoholism. So with the West, so to speak, there has been more of a shift towards substance abuse. That's been more very clear in that. I think for a situation here, because there has not necessarily been a study per se, what was done by NENDO, which is a digital research team, is they looked at sentiment on COVID, and here we see the online sentiment is mostly directed towards government. So there's a frustration towards government here. There's a frustration towards powers of structure. There's a feeling there's a sense of being let down. Also because maybe the way resources are distributed between the two contexts, as Fred would, as I would contrast them, is different. So you have issues more of the isolation. People are feeling that more. Of course, it's being felt across the board, but in the West, that has been one of the bigger concerns and the bigger fears. I think as Africans, we have had the experience of community communication and behavior change. We pretty much we know the drill around public health. We've gone through HIV. Some places have gone through Ebola, so we know the drill around behavior change and public health. So for us, social isolation, whereas it has had its effects, has not been as great as maybe in the West. And for us, the things that we are struggling with are more survival, whereas in the West, the issues have been more existential.
Very, very interesting. Thank you so much, Dr. Wunjuru. Bright or Olaide, do you want to make any sort of closing comments as we wrap up here, either on that particular question or generally? Olaide, yeah, go ahead. Maybe Olaide first, and then Bright.
Okay. Well, thank you so much. I mean, I think my fingers have been quite busy on the chat box just to share any share our contact information, and anyone is most welcome to contact us by email, by WhatsApp, on social media. We're happy to answer any questions you have and take the conversation forward. And thank you so much for this opportunity to have contributed to this conversation. It's very important to us, and we're really, really glad to have been able to share something we hope is useful. Mental health remains something that's very fragile, very sensitive, something that we're still learning to embrace in our part of the world, and therefore something that really is killing us without us recognizing it as quickly as we should. And so I think conversations like this remain so important, and we'll always see the relevance of this in everything that goes on around us, whether it be Black Lives Matter or with COVID-19 or whatever next thing comes up. At the end of the day, human beings as energy and emotions, our mental health is really, really critical. And I think having a framework to think about, well, how does this affect me and those around me is something that we will need to be able to survive whatever comes our way.
Fantastic, thank you so much. And we will be circulating all of the speakers' information and details and all the hotlines, I think, that have been sort of populating on the chat. We'll circulate that as well, sort of post the webinar. Bright, over to you, last few comments.
Yeah, my closing comments are just going to mention on mental health for me, and I think for a lot of people from the poll we've seen today, is a social problem arising from the social stigma. And despite all the interventions you might put in terms of giving medication and everything else, therapy, as long as this individual is going back to a toxic environment, then their mental health will always be in jeopardy. And so we see a need to address this problem through social systems, through policy change, through more awareness creation for each household. I saw a very good quote in the comments from, I think, Faith or someone, that you need to start at the household level for the father, the mother, the brother to understand what mental health is. And we see the easiest way, again, is through art. Music, poetry has been used as a very powerful tool to effect change in history. And as I mentioned earlier, we're working on this festival. Those of you who'd love to hear more about it, please reach out. Those of you who'd love to partner, let's work together. Let's make it have continental or even global impact. And I'm looking forward to having conversations with a lot of you moving forward. Thank you so much, Ariel.
Thank you so much, Bright. And I think at this point, I just wanted to thank everyone for joining us and for sticking with us. I think we blocked maybe an hour of people's time, and I think a lot of us have stuck through an hour and a half. I wanted to hand it over to Nancy as well from AVPA to just make a few closing remarks. But thank you everyone for joining us, and we really appreciate having this really relevant and important conversation. And really excited to see how active the chat is and how many people are already talking about partnerships and ways to collaborate together. And that's exactly why we're doing this. So thank you everyone for your participation. And Nancy, over to you.
Thank you, Ariel. Thank you to Untitled Dialogue for partnering with AVPA to host this series of webinars, Crushing the Curve. I just wanted to bring to everybody's attention one of our largest donors at AVPA is the USADF, or United States Africa Development Foundation, not USAID, they're different from USAID. They're, like I said, they're one of our biggest donors. It's an independent US government agency and has been, for the last 5 years, as you can see in that slide, have actually invested more than $115 million directly into over 1,000 African-owned and operated entities and impacted over 4 million lives. So we thank USADF for their support of our organization. And if any of you would like to reach out to them, there's information at the bottom of that slide, and we'll be circulating it later to all participants and speakers. So thank you very much, USADF. And thank you to all the speakers today. I think the conversation has really been robust and eye-opening. I was really quite startled at the figures around suicide levels, especially amongst men. And this is an issue that I thought other people would kind of pick up, and the participants would pick up and talk more about. But I think it's a very sad situation. We need to really look into that deeper. And even the figures that we're seeing around young girls getting pregnant, 4,000 young girls reported yesterday who have been impregnated in just one county in Kenya, just in the last 2 to 3 months. So these are really sad issues and serious issues, and maybe we'll follow up with other webinars to delve into some of these subjects more closely. But thank you very much to everybody. Have a very nice rest of the week and weekend. At the bottom of your screen, you'll see some information if you want to reach out to anybody at AVPA. Those are some of the contact information. Thank you, and stay well, keep safe.